Quick question before we get started with the show. Do you order lab tests from companies like Dutch, DSL, Genova, or Vibrant America? Hi, I'm Dr. Carrie Jones, Head of Medical Education at Rupa Health, the absolute best place to order, manage, track, and get results from 30-plus lab companies all in one place. Practitioners using Rupa Health are saving well over 15 hours of admin time each week for their lab ordering process. With just a few clicks, you can order from 30-plus lab companies, that's over 3,000 tests, for free in one single portal. That means one invoice for all labs, paid online upfront. Plus, patients get practitioner pricing and receive full patient support through easier personalized collection instructions, automated follow-ups, super bills, answers to testing questions, and so much more. Go to rupahealth.com to sign up for your free account today. Now, let's start the show.
Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being. Our host for Redefining Medicine is Dr. Erica Schwartz. For more than 20 years, Dr. Erica has been at the forefront of advanced patient care, taking the best from conventional and integrative medicine and applying them to prevent disease. Dr. Erica is a distinguished A4M faculty member in disciplines ranging from hormone therapy, peptide therapy, and IV nutritional support.
Welcome to Redefining Medicine. I'm Dr. Erica Schwartz, your host. In our podcast, we interview the leaders, the innovators, those who are changing healthcare for the better for all of us. And today, I'm honored to interview Dr. Peter Staats. Dr. Staats is the one who understands the most about the vagus nerve. Dr. Staats, thank you so much for joining us.
Erica, thank you for having me. It's a pleasure to be here with you.
Thank you.
I do think of the vagus nerve, as you were making that introduction, as the Rodney Dangerfield of nerves. Some of your audience may remember, I get no respect. That's the vagus nerve. Incredibly important, incredibly powerful, and been completely underappreciated on how important it is. When I think about this podcast of Redefining Medicine, I can't think of a better discussion point or jump-off point than the vagus nerve.
I agree with you. And nobody even thinks about it. It's the longest nerve. It runs all the way from top to bottom, and it affects everything in our bodies. So it's unbelievable how little we talk about it.
That's right.
And how little credit we give it.
Right.
So you coming from the pain background is really amazing. So tell us about it. How did you get to it?
Well, I started the pain division at Johns Hopkins back, I won't say how long ago, but a long time ago.
Oh, yeah, you can. We're all into longevity here.
Nobody wants to remember how old
longevity.
I am.
We're into
it's
longevity.
A good thing. That's true. Well, I started the pain division back in the early 1990s, and I was initially very infatuated with how electricity could turn off pain. Mm-hmm. And I became an implanting surgeon, implanting spinal cord stimulators, and was, in fact, the first anesthesiologist with surgical privileges in the United States at an academic university to implant these devices. And my interest in neuromodulation grew just out of pain, but into the power of electricity in controlling diseases. So we started to move into spasticity disorders, and when I was president of the then NANS, North American Neuromodulation Society, there was a big focus for me on expanding this out into artificial vision, artificial hearing, into concepts of improving perfusion in the heart. And along that time frame, I learned that my son had peanut allergies. And so thinking about what was available for a child at that time, which was really epinephrine. That was really what you could do, epinephrine or maybe steroids.
Horrible.
We wanted to think about what is the neural control of the lungs, which is what was killing the kids. And we figured out through some hard work, collaborating with the group up at Columbia. Friends of mine from Hopkins had moved up to Columbia. We figured out how to block airway reactivity. We then were studying that in patients with status asthmaticus or very severe asthma disorders in the emergency room. And surreptitiously, the patient said, my headaches went away. We were talking earlier about patients with headaches. And the focus of the company initially went off and started to really work on headache disorders. And electroCore now makes a device that has 6 different FDA-approved clearances for primary headache disorders, including acute treatment of migraine, prevention of migraine, acute treatment of cluster headache, prevention of cluster headache, paroxysmal hemicrania, hemicrania continuum. And we've expanded off from there, looking at other neurologic problems as well as peripheral problems that the vagus nerve controls.
Unbelievable. And you think about how we're developing new drugs when you're talking about a very non-invasive, easy way of stimulating the vagus nerve and then getting results. And I was telling you before that in our practice, without even knowing Dr. Staats, we had started doing the vagal nerve stimulation with the gamma core, and we wound up seeing patients feeling great with no medication.
Yeah.
I mean, how easy and simple is that? So explain to us what happens.
Well, first of all, I think it's important to think of who we are as beings.
Right.
We're not a chemical being, we're an electrical chemical being. And when you take a look at other areas in medicine, what do you do if you have a slowing heart? Well, you put in a pacemaker, electrical control. What do you do if you have really bad seizures and drugs don't work? You put in a vagus nerve stimulator implanted. What do you do if you have Parkinson's disease and all the drugs stop working?
Right.
A deep brain stimulator. This is the next generation of that, of saying we are going to optimize electricity to control a variety of diseases. And right now the FDA has granted us FDA clearances in headache, breakthrough designation in breathing difficulties with COVID, and a breakthrough designation, there's an emergency use authorization in the COVID and breakthrough designation in PTSD. But I believe that the vagus nerve is going to be shown to have powerful impact on a variety of other diseases down the road.
What are you referring to? Give us examples, please.
When I'm about to go speak in a few minutes, talk about post-traumatic stress disorder, acute treatment of stroke, and altering the course of the disease of somebody having a stroke acutely right now. They're having a stroke.
Right.
It's showing up with you right now. And we have some data now in animals and then in humans showing that we have the potential to alter the course of that stroke to make it much less impactful down the road, a month later, 3 months later, how much tissue damage was destroyed. That's
amazing.
It's amazing. I mean,
it's not just small.
That's a big deal.
Yeah.
To quote Joe Biden, that's a big deal. And so look, we're working on that. There's work going on in inflammation, like rheumatoid arthritis, and how the vagus nerve controls inflammation throughout the body. And when you start to think about the general principles of what we're doing, we don't cure 1,000 different disorders. We work on a central pathway, which is the vagus nerve, and the vagus nerve, teleologically, is your command and control of inflammation throughout your body. And so this is just another avenue, another option for this audience, for this people who are interested in healthy styles of life, to optimize using a very safe approach to help people with, initially right now it's FDA approval and headache, but down the road I think we're going to get to the point of looking at other disorders, and they're starting to roll out now. It's really exciting. It's a really exciting time.
I think it's amazing.
Yeah.
I think that, you go to the FDA and say about FDA, but I'm a clinician, and the FDA goes just so far. When I have a patient sitting in front of me, it's between me and the patient. The FDA doesn't really come in there. The decision is between me and the patient.
Yeah.
So I think that we're talking about things that really matter, that change the way we look at medicine. It's like you're so totally in sync with what we're talking about. It's redefining medicine. We're not talking about a new drug. We're talking about a non-invasive way of stimulating the vagus nerve, which is pretty much the master nerve that affects so much of our body functions. I think it's amazing. Yeah. Amazing. Thank you so much. I really appreciate you coming and sharing the information with me, and I can't thank you enough for doing this for us.
Well, it's been my pleasure, and thank you for having me.